Which muscle group extends the leg at the knee? Quadriceps. They are located at the front of the thigh. They consist of four muscles: the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. Which bone forms the shoulder blade? Scapula. The scapula is a flat, triangular bone that connects the arm to the trunk. Multiple muscles attach to it, allowing movement and stabilization of the shoulder and arm. Which muscle forms the chest? Pectoralis major. It covers most of the chest. It moves the arm forward and inward, enabling pushing, lifting, hugging, and assisting respiration. Which main nerve controls thigh sensation? Femoral. The femoral nerve provides sensation to the front of the thigh and controls the quadriceps muscles that extend the knee. Damage can cause numbness in the anterior thigh and weakness in knee extension. Which bone forms the heel? Calcaneus. The calcaneus, or heel bone, is the largest tarsal bone. It bears body weight when standing and provides leverage for walking, running, and jumping. Which nerve controls shoulder muscles? Axillary. The axillary nerve controls the deltoid and teres minor muscles, enabling shoulder abduction and rotation, while also providing sensation to the shoulder. Which tissue surrounds muscles and organs? Fascia. It is a multi-layered system of connective tissue that encases and supports every organ, muscle, bone, nerve, and blood vessel in the body. Which condition results from low oxygen in tissues? Hypoxia. It occurs when tissues receive insufficient oxygen. It can cause fatigue, confusion, bluish skin, and, in severe cases, organ dysfunction or failure. Which organ stores glucose as glycogen? Liver. It stores excess glucose as glycogen and releases it as needed to maintain stable blood sugar levels. It acts as the body's main energy reservoir between meals. Which condition involves thyroid overactivity? Hyperthyroidism. The thyroid gland produces excess hormone, accelerating metabolism. Symptoms include weight loss, rapid heartbeat, sweating, anxiety, and tremors. Which blood test measures sugar levels over time? Glycated hemoglobin. The HbA1c test measures average blood glucose over the past 2 to 3 months, providing a key tool for diagnosing and monitoring diabetes. Which muscles flexes the knee? Hamstrings. The hamstrings are 3 muscles at the back of the thigh: the biceps femoris, semitendinosus, and semimembranosus. They bend the knee and assist with hip extension. Which nerve controls tongue movement? Hypoglossal. The hypoglossal nerve controls tongue movements, enabling speech, chewing, and swallowing. Damage can lead to difficulty moving the tongue. Which vitamin deficiency causes scurvy? Ascorbic acid. Vitamin C is essential for collagen production, which strengthens skin, gums, and blood vessels. Deficiency causes scurvy, leading to bleeding gums, fragile skin, and slow wound healing. Which organ stores urine before excretion? Bladder. It stores urine until it can be voluntarily released. Stretch receptors signal the brain when urination is needed. Which bone forms the upper arm? Humerus. It runs from shoulder to elbow, serving as a structural base for arm muscles. It is essential for lifting, throwing, and other arm movements. Which muscle rotates the shoulder? Infraspinatus. The infraspinatus is part of the rotator cuff. It externally rotates the shoulder and helps stabilize the joint during arm movements. Which structure produces cerebrospinal fluid? Choroid plexus. It is a network of blood vessels in the brain's ventricles. It filters blood to produce cerebrospinal fluid, which cushions and nourishes the brain and spinal cord. Which artery is felt at the wrist? Radial. It runs along the thumb side of the wrist. Which muscle raises the eyebrows? Frontalis. It elevates the eyebrows and wrinkles the forehead, playing an important role in facial expressions such as surprise or curiosity. Which bone forms the upper jaw? Maxilla. It forms the upper jaw, anchors the upper teeth, and helps shape the face, nose, and roof of the mouth. Which gland produces melatonin? Pineal. It is a small structure deep in the brain, produces melatonin, a hormone that regulates sleep-wake cycles and circadian rhythms. Which nerve controls hearing? Cochlear. It carries sound signals from the inner ear to the brain. Its vestibular branch is responsible for balance. Which muscle rotates the forearm? Pronator teres. It rotates the forearm so the palm faces downward, allowing everyday actions like writing or using tools. Which condition involves bone weakening? Osteoporosis. It is a condition where bones lose density and become fragile, greatly increasing fracture risk, especially in the hips, spine, and wrists.